Hi friends, I am Dr. Ravadu Prasad. I am a consultant for ENT and hearing implantology at Aster Arvind Hospital, Bangalore. I am going to talk to you about geriatric hearing loss and its effects and what is the treatment available and when should a patient, an elderly patient, get the treatment for hearing loss. The elderly do suffer from something called as a hearing loss which is age related, which happens in both ears and progresses gradually. Most of the elderly in our country fail to take the necessary required treatment for this kind of hearing loss for multiple reasons. Most of them are shy to even go and tell their own family members that they have hearing loss. Many of them, after finding out that they have hearing loss, do not venture out to get a hearing aid. Most of them, even after getting a hearing aid, do not wear them regularly. And some of them who do not benefit after prolonged hearing usage are finding themselves in a spot of bother on what to do next. Now I'll be telling certain things about what hearing loss can do in elderly age group. In the elderly, you would find that conversation, interpersonal relationship, conversations with their own family friends, with their own family members is very essential and they really enjoy it. When a person is deprived of having a normal conversation due to their hearing loss, they find it very difficult to communicate and go into a shell. They also have a problem in expressing that they have hearing loss, so they do not communicate much. We generally find these elderly people going into depression, get forgetful, do not speak much, their speech does get affected, and eventually dementia, which is very difficult to treat later. When a person of an age group, which is basically elderly age group, has these kind of problems with related to hearing, they need to be attended to in the right way. Hearing assessment and providing the necessary hearing aided devices is something which we will discuss. Hearing aids are provided for those elderly who have hearing loss either in one or both ears according to their levels of hearing, programmed in the right way, and counsel them to make sure that they wear it regularly. Once they are convinced of what is best for them, you will definitely see that the elderly would appreciate a hearing aid much better. Many of them go and take a hearing aid based on its size or its shape so that others cannot find out that they have hearing loss, which again puts them in a problem. Choosing the right hearing aid for the hearing loss is very essential. Some patients who are continuous or prolonged hearing aid users, after a period of time, find that they do not have any more benefit with hearing aids. Many of them try to buy newer hearing aids or better hearing aids or more high powered hearing aids, eventually not landing with any benefit. These are the patients who require cochlear implants. And cochlear implants are those devices which will enable the person to hear by performing the function of the cochlea and not of a hearing aid. Hearing aid would amplify the sound signals and send it to the inner ear, which will further send it to the brain. When the cochlea is not functioning the right way or has no more adequate function is when we would look for a cochlear implant, wherein the signals are converted to electrical impulses, which is supposed to be done by the cochlea, is now going to be done by the cochlear implant and then sent to the brain for further processing. Initially, the elderly would wait for a long period of time until both their ears would go into severe to profound deafness or total near total deafness and then choose a cochlear implant. By that time, like I said earlier, they would have already gone into a mode of depression, loneliness, inability to communicate with their own loved ones, and also forgetfulness, dementia. Now, what we are doing here is, or what is recommended internationally, is whenever a patient has no more benefit with the hearing aid, be it only in one of the ears and having some function in the other ear, you can straight away implant the patient with a cochlear implant device. do not hesitate to approach us for the right kind of treatment. Cochlear implants will change their lives, will enable them to communicate better, and eventually will appreciate the quality of sound that the cochlear implant provides, which is much better than what a hearing aid can do at that point of time. Some patients can present with something called as asymmetrical hearing loss. Asymmetrical hearing loss is different levels of hearing in both ears, and one ear being more worse than the other. If the worst ear is not progressing well or is not responding well to hearing aids, it's time to switch over to a cochlear implant. Do approach us at Aster RV Hospital for the best kind of quality care that we can provide you with respect to hearing. Thank you.